Therapeutic Listening by Amanda Galoni and Russell Hardcastle, Student Occupational Therapy Assistants at Zane State College. Therapeutic listening is a method of auditory intervention used by thousands of therapists around the world. It is a highly individualized, music-based tool that activates listening to help people tune into and respond to their world. It utilizes electronically altered compact discs that are specifically tailored by sensory integrative professionals to match the client's needs. It is high-quality music recorded specifically for therapeutic listening that's altered to exaggerate the sounds that naturally capture attention and tap into the parts of the brain involved in regulating bodily functions, relating to others, and organizing behavior. Auditory training has been used in Europe since the mid-1900s and first began in France by Alfred Tomatis, an ENT doctor. His method is based on filtered sound and the effects of high-frequency sounds for varying lengths of time. Therapeutic listening is used to address sensory processing disorders, as well as children diagnosed with ADD and ADHD, autism, and Down syndrome, to name a few. Sheila Frick, an occupational therapist, based her work on the works of Dr. Alfred Tomatis and Dr. Guy Berard, and created therapeutic listening to coincide with sensory integration treatment. The theory behind therapeutic listening is the width of wavelengths are different and allow for better concentration to perform tasks. Frick states that listening is a function of the entire brain and uses the whole body. By using therapeutic listening, the child is able to work on actively engaging their world through improved attention, organized behavior, postural control, coordination, and motor planning. It is based strongly on the sensory integrative frames of reference. Therapeutic listening coupled with sensory integrative treatments tend to speed the emergence of attention, organized behavior, coordination, fine motor control, motor planning, oral motor skills and articulation, social skills, and visual motor skill development. Improved regulation of sensory information, such as improvement in sleep-wake cycles, reduction of sensory sensitivities, improved self-regulation, toilet training, cessation of bedwetting, increased regularity of hunger and thirst cycles, and improved focus and intention. Improved postural control, such as establishment of control at the middle of the body, ability to sustain control on stable and moving surfaces, improved control at the shoulder and hip joints, improved body awareness and posture, and active use of rotation and movement patterns. Improved motor control, such as improved coordination, improved articulation, and improved fine motor skill development. Improved spatial temporal organization, such as improved timing of motor skill execution, improved timing of social interactions, improved ability to maneuver through space, improved handwriting and drawing skills, and improved discrimination of spatial concepts and directionality. The final goal for therapeutic listening is improved communication through greater range of nonverbal communication. Nonverbal communication matches communicative intent. There is greater emotional expressiveness, improved response to speech signal, initiation of sound play in speech, improved performance in noisy environments, more consistent performance across all environments, and a more confident communicator. Children that would benefit from therapeutic listening are those diagnosed with sensory processing disorders, poor balance or coordination, ADD or ADHD, autism, PDD, Down syndrome, learning disabilities, perceptual difficulties, low muscle tone, or communication difficulties. In comparison to other sound-based interventions, therapeutic listening provides practitioners and families an economical sound-based therapy tool to augment their traditional sensory integrative treatment approach. In order to participate in therapeutic listening, the child must be seen by a therapeutic listening provider who will be able to assess the unique needs of your child and develop an individualized program. Along with the assessment, there is therapeutic listening equipment that is needed. Headphones by Sennheiser HD500A, which are specific for therapeutic listening. They are the ones that allow for high frequency to be heard for the child. A CD player or an MP3 player, and CDs. Parents can purchase CDs not modified, but if you are a therapist, you can purchase them modified, which is needed for the therapeutic listening technique. There are 6 CDs that are used in this therapeutic listening program, and each can be found modified or non-modified. The modified versions have been altered in frequency to help the child improve specific skills. Each CD addresses specific needs, as you can see here in the chart. Therapeutic listening is done as a home program and sometimes in treatment. CD selection is based on the knowledge of the child and their needs. Typically, the child will listen to a CD twice a day for 20 to 30 minutes at a time with at least 3 to 4 hours between the times. The headphones have to be special as they have to be able to play to a certain level and frequency. Specific CDs are used to modify the sounds, and each one does different things. The child is not encouraged to listen to one particular CD for more than 6 weeks because the brain has grown accustomed to the frequencies and will no longer be receptive to the changes the CD was trying to create in the child. Please look into these articles as well as these websites.